So here's the thing. Because there's no blood test, no simple way of diagnosing the problem, what we're going to do is walk everyone through a way of diagnosing themselves. So Dr. Caudle, come join me if you don't mind.
Okay.
I'm going to grab Morgan. Morgan, you're going to join us if you don't mind. You'll speak for the group, all right?
All right.
So there's a new at-home fibromyalgia questionnaire. Everyone in the audience has one. It's also available on our website. It's easy to do. It's 2 questions. Only 2 questions you got to answer. The first is to calculate how widespread your pain is. So Dr. Caudle, please explain how you use this mannequin to teach us that.
Sure. Well, this is sort of our model. We think of fibromyalgia as having chronic widespread pain. Widespread really means what it sounds like. Pain can happen anywhere in the body. We have both the front as well as the back. So you can see here pain can be on the neck. It can be sort of in the back of the shoulders. It can be in the lower back here, the buttocks, etc. And again, even down to the legs. And what's really important to note here is really all of the areas that you've had pain in these regions for the last 3 months or so. Where have you had pain?
Right. So everyone in the audience and at home, if you can get this off the website, just quickly check the boxes that apply to your pain. You're going to need that later on. So Morgan, come on back here. Let's talk about your case. So we actually looked at your model here, and this is this is what the illustration looks like on the page. So if I look at this right now and I add up all the red boxes that you checked off, it's 14 pain boxes. Dr. Caudle, do I do that right?
You did. You absolutely. You just want to count up the areas that you've checked off on your boxes, add them up, and see what you come up with. And it can be both the front and the back of the body as well.
So remember that number 14. Everyone check off the boxes that apply to you and keep track of that number. The next thing, the second question, only 2 again, is to tally your overlapping symptoms. If you don't mind, walk us through these.
Sure. So we talked about fibro being not just pain, but also other symptoms that you may have as well. And I think you've probably experienced these, right? But remember, fibro patients can often have other symptoms. Bladder issues, headache, depression, anxiety, heartburn. There's many others. This is just a few.
So you checked off all these boxes. There were 6 total. So we got everyone okay with you? So you can add up the number of pain points you have from the prior question and the number of these overlapping symptoms, and you're going to put them together, right?
Yes.
And when you have that number, what does that mean?
So what I would say is, well, actually, we've got your number, right? So we've got 14 plus 6. Do we have? So we have a total of 20.
Yeah.
What I would say for people who are watching at home, you're doing this questionnaire. If you have at least 7 or more symptoms, and at least 3 of those are in the pain category, you need to see your doctor. Now, let me be very clear. This is not the specific diagnosis for fibromyalgia. This will not diagnose your fibromyalgia. But what this is a great tool to track your symptoms. Get an idea of what's going on with your body to be able to literally take this, bring it into your doctor, and talk more about it.
So once you figured out that you may have fibromyalgia and you're no longer invisible, which is a big part of what we're talking about today, what do you do with that? What are the current treatments that might be helpful? Give some hope to patients suffering from fibromyalgia.
Sure. Well, there's a lot of great treatments. And that's the thing. When you go to your doctor, they're going to want to rule out other conditions, want to probably do some tests and things like that. But there are great treatments. There's a number of FDA-approved medications that are on the market that treat fibromyalgia well. But we think one of the best things is sort of lifestyle changes. I always tell my patients, let's, number 1, get rid of the stress. Number 2, let's get you moving. We want to manage the anxiety, depression, and stress that comes with it, but we also want to do sort of gentle exercises. And I don't know how you felt about it, but a lot of my fibro patients, they say, well, I'm already in pain, Dr. Caudle. Why do I want to move anymore? But the truth of the matter is we know graded exercises, yoga, tai chi, kind of pool exercises, physical therapy can actually be very helpful. So using that big pot of stuff, we want to pull our therapies out.
Yeah.
Is this helpful for you?
Yes, a lot of that.
All right. God bless you. Thanks for being here.